Okay, so we're trying in the tray that we're gonna take the mold with. Very nice, it's fitting nicely. So we're gonna use this tray. All right, so I'm going to do your bite registration. So the way you bite down, we have that for the molds we're about to take. So open your mouth, put the tip of your tongue to the roof of your mouth, go all the way back now. Perfect, this is the perfect position, and then you're gonna bite down. So now practice doing that another 3 times. So open wide, the tip of your tongue to the roof of your mouth all the way back, your jaw goes back then, and bite down. Perfect, can you do that again? Back, perfect, and open again. And last time. Now open. I'm going to put the mold on your teeth, but you're not gonna bite till I tell you, and do the exact thing where you put the tip of your tongue to the roof of your mouth all the way back and bite down. Bite down. Pretend it's not there. It's going to stay here for 60 seconds. All right, so it's hard now. You can open. Perfect. So this is your bite outside of your mouth. Isn't that cool? So now the lab knows exactly how to articulate the models of your mouth outside of your mouth. Very nice. So we're gonna try the bottom tray. Okay, it fits very nicely. So we're gonna put mold in here and then capture your teeth outside of your mouth.
Oh, didn't we just do that?
We did the top, and now this is the bottom.
Okay, gotcha.
So then we have the top and the bottom molds. They're going to pour it up into models. And then with the bite registration we just took, they're going to articulate it. So we have your mouth outside of your mouth. All right, so I'm going to prepare the mold for you. It's going to be in your mouth only for a minute until it sets. So it's called alginate.
Are we doing the same thing?
Yeah, but I'm going to put the mold. I tested the trays and they fit perfectly. But now I'm going to put material in them and put it in your mouth. And it sets after a minute, and this is how we mix it. It's like pottery class. I always do the bottom first, because patients are more comfortable with the bottom. All right, so we're gonna put this in the mouth. Stay open. Good job. All right. So breathe through your nose. Your mouth is wide open, so obviously you're getting all the oxygen. And think happy thoughts. Relax. And then in about 30 seconds, I take it out. Perfect.
I always feel like your teeth are going to come out.
It does. But see, no teeth. So it looks good, right?
Better than it used to be.
Yeah.
Because it used to really be rough to get it out.
But this is really good material. So I just did the bottom, and now I'm going to do the top, putting mold, impression material here to take a mold. 2 scoops of alginate. And this is a really good material. It tastes good. For our patients, we've been using it for 20 years now. So we need more water. Mix it. Put all the powder in there. So if you take a mold just like this, it's going to be very lumpy. And you know, as you see, teeth are very small, so you have to make sure it's smooth and perfect. So you start with a good mold. The rest of your procedure is good. You start with a bad mold, then your prosthetic is not going to be good. And it's not going to fit well. So it always starts with a good mold. Make sure it's smooth, no bubbles. I'm going to capture all the nooks and crannies of the teeth. So you load the tray. So we're doing a procedure for the premolar, which is this area. So we're going to not overwhelm the back of the tray so that the mold doesn't come back when I seed it and make the patient gag. So this is a good amount of impression material. All right, so we're about to put the mold in. Oh, don't close. It's okay. You're fine. Breathe through your nose. You can put your lip over it. Okay, so I'm about to take it out. Gonna hear a snap. No teeth.
Yay.
So this is all the teeth outside of the mouth. We're gonna pour it up in stone, and then you have the mouth outside of the mouth.
What was the blue one for?
The blue one is your bite registration.
Oh.
And then they put it against the mold of the bottom, and they mount it.
Ah.
They mount it so that we replicate your mouth outside.
Ah.
And then we'll do the procedure where you take the tooth out
So they use that to make the tooth.
to make the tooth. Yes. To fabricate the tooth customized to your mouth. Yes. Of exactly the shape and the size and the way that tooth will bite into the model on the bottom or in your mouth to your bottom jaw. This is the shade guide, all different colors of the teeth. We're going to see which color is the closest or which shade is the closest to the tooth we're going to take out. This is the tooth we're going to take out, but we don't care about the color of that since it's going to be gone. We care about the tooth next to it.
Right.
So when they did the crown, they made it a little lighter than your teeth. As you see, this is lighter than your teeth. So I'm going to pick the shades that seems closest to it, and then you'll decide if it's good for you. What do you think of this color?
Good. Good.
This tooth is whiter than all your teeth. So you're happy with this color?
Yes.
Okay, we're gonna also test it with the outside light. Sometimes the outside light looks different than the office.
Okay.
Okay, so let's go together. All right, so this is your tooth that stays. This is the one that's we're going to take out. So if I put this color next to it, you feel that this is a good color?
Yeah.
Now, this tooth is lighter than the rest of your teeth. So I went halfway between the tooth and the other teeth.
But it's going to be adjacent to the one that's lighter,
Exactly.
so that makes sense.
This is the tooth that's coming out, and this is the tooth that stays. The crown is a little lighter than the other teeth. Now I'm putting it next to the crown. Do you like this shape? All right.
Yeah, it looks fine.
It's A1, so we picked it out of all these shades.
Okay, so I'm in the process of getting a dental implant, and this is, as Dr. Moss explained to me, this is going to be the temporary for when I get the extraction done, and they replace the tooth temporarily while I'm waiting for the permanent tooth.